Multiple sclerosis is the most common cause of non-traumatic disability in people aged 18 to 65 years. And as rehab professionals, we know that exercise is one of the mainstays of treatment for these clients. Though not definitively established, exercise has the most potential promise to be disease-modifying if started early in the course of the disease. But alongside exercise, there are other important interventions to consider, like fatigue management and education. In the article that we are reviewing today, we will look at a massive overview of reviews that outlines the strength of the evidence behind multiple types of rehab interventions. And after we look at this massive state of the science, we will welcome to the podcast Sarah Adam, OTD. Sarah is an occupational therapist with MS who has taken her pursuit of adaptive sports to an elite level and recently earned a silver in wheelchair rugby at the 2024 Paralympic Games in Paris. Sarah was the first woman to ever play on Team USA's wheelchair rugby team and also made history as the first woman to score a point during an Olympic wheelchair rugby game. We clearly just have so much to learn from Sarah. I know her story is going to inspire your OT practice, so let's dive in. Welcome to the OT Potential Podcast, where we review new and influential OT journal articles, then invite an expert guest to help us pull out actionable takeaways that you can implement in your practice starting today. Welcome to the podcast. I'm your host, Sarah Lyon, OTRL. And before we dive into this big topic of OT and multiple sclerosis, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform, but to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. So bearing in mind that this could count as a CEU course, I wanted to state our 2 learning objectives so you can be thinking about them throughout the podcast today. Our first learning objective is you will be able to identify which OT interventions for MS have the strongest support in research. Second, you will be able to recognize considerations for implementing exercise-based interventions for people with MS. So let's begin at looking at this journal article, and then we will bring on Sarah to discuss how this research could play out in your practice. The article that we are reviewing today is called Effective Rehabilitation Interventions and Participation Among People with Multiple Sclerosis, an overview of reviews. This article comes to us from the Annals of Physical and Rehabilitation Medicine, and it was published in 2022. So this article begins with just this quick intro into MS and rehab. As I mentioned already, multiple sclerosis is the leading cause of non-traumatic disability for adults, and its prevalence is on the rise. According to a recent study, MS affects 30% more people worldwide today than it did in 2013. MS is also around 3 times more common in women than in men. As a reminder, MS is classified into these variants: benign, relapsing remitting, which is the most common variant, progressive relapsing, primary progressive, and secondary progressive. Treatment for MS includes pharmacology, some of which is actually aimed at reducing relapse rates. But due to the complexity of MS, multidisciplinary rehab is also an essential part of treatment. Rehabilitation for people with MS should target and be tailored to the disease phase and take into account the complexity of this condition. So while there have been past reviews of rehab for MS, I have already covered this before in the OT Potential Club and looked at the Cochrane reviews, but that was back in 2019. And given the rapidly developing nature of research in this area, it was time for an update, which led the authors to this research. So what was the intent of this paper? The authors sought to provide an overview of quantitative and qualitative systematic reviews. The objective was to systematically synthesize and evaluate the evidence for rehabilitation for people with MS to inform future clinical guidelines. So what were their methods for this big undertaking? They used the Joanna Briggs Institute methodology, And systematic reviews were eligible for inclusion if they involve people with MS who are over the age of 18. All rehabilitation approaches were eligible. The areas of outcome were reported according to the ICF framework, and the authors also shared the strength of the evidence. So what were their results? 72 systematic reviews were included in this overview. 66 were quantitative and 6 were qualitative. For the purposes of this podcast, I am going to present only the studies in the quantitative section that had strong to moderate evidence. There is so much to dig into in this paper, and I definitely encourage you to read it in full. But for our purposes today, I'm going to narrow in on this strong and moderate evidence. And I do want to specifically highlight what they said about occupational therapy for MS. The researchers found that the modalities studied in a particular systematic review, which included activity of daily living training, computer-based cognitive training, memory training, and strength training, that of these modalities, only strength training showed an effect on endurance, strength, and gait. They recommended that OT should focus on full body training in combination with goal setting, patient education, and home exercises. In addition to this segment on occupational therapy intervention, the review found strong to moderate evidence to support these additional interventions and modalities for use with people with MS. I'm just going to go ahead and read through this list. I want you to know in the article there are multiple studies supporting each of these that either have strong or moderate evidence behind them. For members of the OT Potential Club, I'm going to organize this really nicely for you so you can dig in. But for our purposes here, I'm just going to read them so you can really get a sense of the many ways we can support people with MS. So headed down this list, there is mixed rehabilitation interventions. There is telerehabilitation, cognitive and psychological interventions, mind-body interventions, fatigue management, exercise therapy, physical activity, physiotherapy, robot-assisted gait training, virtual reality training, electrical stimulation, respiratory training, whole body vibration, aquatic therapy, Pilates, Tai Chi, and yoga, hippotherapy, nutritional and dietary supplements, information provision, and vocational rehabilitation. Headed into the author's discussion and conclusion, they share there was strong evidence for the effectiveness of multidisciplinary, cognitive, and exercise approaches, as well as physical therapy and occupational therapy, as long as it included full body training. Additionally, the researchers found that employment significantly influences quality of life. Thus, vocational rehab should be initiated early. While all of the modalities listed above could impact quality of life, exercise, again, is the one that has the potential to be disease modifying from what we understand now. Exercise should be individually prescribed and tailored as a medication, as it is just that important for these clients. Furthermore, the exercise postponement theory suggests that long-term, moderate to high intensity exercise may postpone the onset of clinical diagnosis of MS and diminish disease activity. It is important to note that exercise and face-to-face cognitive-inspired education programs were more effective than medication in fatigue management as well. So those are some of the highlights from the discussion. Again, there is just more good information in there that for our purposes today we won't cover, but I encourage you to read that article in full. So that is the end of this article review. And this article just did a really good job summarizing the research that is out there for us when we consider treatment for MS. But honestly, I feel like even though we have lots of research, we as OTs simply are not getting these treatments into the hands of most people with MS. The state of MS therapy to me is just this complex problem for us to be looking at from multiple angles. And I'm so thankful to welcome a guest to the podcast who can think about these challenges from multiple perspectives. And that guest is Sarah L. Adam, OTD, OTRL, CBIS. Sarah is an occupational science and occupational therapy assistant professor and academic fieldwork coordinator at St. Louis University. Dr. Adam has special research interests in enhancing independence and participation of individuals with disability through community-based exercise and adaptive sports. She has collaborated with an independent living center and adaptive health and wellness center to create a comprehensive assessment protocol and exercise program for adults with disabilities. And as I mentioned at the top, Sarah has lived experience with MS, and part of her own journey has led her to complete in adaptive sports at an elite level. And again, she recently earned that silver medal in wheelchair rugby at the 2024 Paralympic Games in Paris. So without further ado, I just am so honored, so thankful to patch Sarah into this podcast. Welcome to the podcast, Sarah. It's great to have you.
Yeah, thanks for having me.
I am so excited you're here. I think you're my 92nd guest, and we've had so many just fabulous OTs, but I've never teased who my guest was and gotten fangirling messages where people are so excited for our next guest. And I've already gotten messages about where other OTs had the same experience I did, where I was watching your Paralympic game and my kids just got sucked in and they were so excited. And
I love that. That's what we want.
Yes.
We want people sharing our stories, share what we do, share what we're passionate about. So excited to join the podcast to continue sharing what I'm passionate about.
Oh, yeah, just so awesome. And yeah, I'm so thankful you're here. And I've just been reflecting today and just feeling so thankful also from the lens of so many times on the podcast, we have OTs who treat a specific condition. And I know that you're showing up today with an OT brain and that lived experience. And I'm just so thankful that you're willing to do that. I know that, that's a little harder to just show up than with just an OT brain. And I'm thankful that you're willing to do that.
Yeah, more than happy. I always tell my students, open book. I remember being, either a new grad or a student and just really interested in wanting to learn more and have so many questions. And as long as it comes from a place of curiosity, I'm an open book to answer it and build that knowledge. So
let's start towards the beginning of your story. I'm so curious to hear how your OT career started off and then how that intersected with your MS diagnosis, just to get that background of how those two stories intersected.
Yeah. So I was in OT school and they say white coat syndrome, right? Or whatever we're studying, we think that we have it. And I was the complete opposite. I could explain away just about any symptoms that were going on. And we were in an assessments class and my professor noted that there was some weakness in my hand. He's like, oh, get that checked out. I was like, oh, okay. I got treated for a hand injury. I was like, that's done. And then maybe 9 months, the timeline I can't quite remember. It's all a little bit of a blur, to be quite honest. But a couple months down the road was having some incontinence at night and some clearly neurological symptoms. And so got started with a MS diagnosis, which then, as many of you know, takes a little while. So it's a little over a year of that, of getting tests and diagnostics and making sure that this is in fact what's going on. And so I was it was May of 2016 as I was about to walk across the stage of graduation and getting the official that call that, the diagnosis is officially MS as I'm getting my OT degree. And hard thing to kind of wrap your brain around, but it ultimately is who better than an occupational therapist to help manage such a complex disease? I had so many tools already in my tool belt to help understand what I need to do to take care of myself and continue to adjust as I lost function and still be able to do what was meaningful to me and what I wanted to do. So really helpful to kind of have both aspects of that, but certainly a bit of a shock when you're so excited to be a clinician and I've got my future plan. I found the population that I loved working with, which was adult neuro inpatient, which is very physically taxing. And so, there's the thoughts of I don't know how long I'm going to be able to practice clinically because of this progressive condition. But I think part of that was what motivated me to really dive full force, put my all into learning and doing as much as I can to be the best OT and then switch to academia.
Yeah, and I have a gap in following your story. Did you work clinically for a little bit then and then go into academia?
Yep. So I was fortunate. I got to work 5 years clinically on the neuro inpatient unit, which was so much fun. I love it. Something I get to do with my students now is find that area that you're just super passionate about, the population and the setting. And when you find that just right population for you, it is so much fun and so rewarding to work with the patient. So I did that until 2021. So worked through COVID in the hospital, and had actually sort of switched towards the end in the hospital of more like administrative roles, preparing for TJC, hospital education, that kind of stuff. And then started working here at St. Louis University as a professor of occupational therapy in the fall of 2021.
Awesome. I wish you were my professor. That's awesome. You'd be so.
Well, for a while I had the good ride. I was academic fieldwork coordinator, which, has its own issue, but it allowed me to just be the fun aunt that went into the classes, the labs, and like teach the fun stuff and leave before the grading and the tests.
Yes.
And, now I'm starting to pick up a few more classes. So, but it's fun.
Oh, that's awesome. So in that course, have you received OT services, or do you find yourself OTing yourself? What kind of supports have you found helpful?
Yeah, I will say, so I'll start with PT, and I avoid my PTs like the plague, which they don't quite appreciate. But they're the most helpful. I do a lot of strength and conditioning work for my, being an athlete, being a Paralympic athlete, that I've basically now transitioned to that just being my PT. And then the OT stuff, I don't see an occupational therapist. It's a lot, of just knowing the different equipment and resources and energy conservation and things that I already know.
That you know.
Yeah. So as I'm losing function and as task becomes hard, it's easy for me to kind of figure out, well, why is that hard? How do I need to adjust it? What tools are available to me? And build up that toolbox on my own. So haven't seen an OT yet, other than like a wrist injury or something like that. Can't quite go into hand therapy. I don't know that area well enough.
Yeah. So you did this clinical work, your transition to academia. In the background, you're doing wheelchair rugby, gets you this silver medal at the Paralympics. If people have not watched The Goal, go watch The Goal. It's so much fun, and took you on this other unique journey alongside all these other things going on. I have like a million questions about that journey, but I think I want to ask, like, how has that experience that you're like just coming off of that silver medal, how has that like shaped your identity alongside these other identities?
Yeah, I wear a lot of different hats as far as, I'm being the athlete, I'm being the occupational therapist, I'm being the professor, the academic field coordinator. So there's a lot of different hats I wear. I think for me, coming back from the Paralympic experience, and number one, reconnected me to my identity as an elite athlete. I grew up playing sports, played college softball for a year. So there's always that competitive elite athlete mentality, the being part of a team, in particular, a sports team, that it reconnected me with that side of myself, which was incredibly helpful. And then coming back, I think, my line of area of interest when I was a student in OT school was adaptive sports and exercise for people with disabilities. Because I love the sports and I loved OT, and like combining that adaptive sports made so much sense to focus on that area. So it's kind of reignited my passion to delve back into that research area, go speak on that topic. I'm just so passionate about how important the use of adaptive sports and exercise is for people with disabilities, not only like physical health, mental health, whatnot, but also connecting them to their identities as an athlete and getting them connected with a group of people, a community of people who have a like-minded kind of mentality that was super helpful for me. So incorporating all that, and I find myself in the classroom incorporating a lot of the lessons that I learned of like being comfortable learning through failure and stepping outside that comfort zone and identifying areas that you need to improve on and finding your own resources. So there's a lot of things I did as an athlete that I can see happening with my students. And honestly, my teaching philosophy that you have to submit when you go in academia closely reflects my coaching philosophy. And I actually drew heavily upon my coaching philosophy for how I choose to teach. So my worlds, while different hats, are interwoven in so many different ways between my life as an athlete and my life as a professor and as an OT. And I'm really fortunate to have that.
Mm-hmm. Oh, I can just so clearly see that intersection and how it all builds off each other, and that incredible lens that you show up to with all these spaces in. I want to ask about, we had this article that was this big review of different interventions for MS. Just kind of
many.
I was surprised how just many. I mean, it's a review of systematic reviews, and so you're talking about so much research. There definitely saw exercise as like kind of the standout thing to consider, but then there's lots of other things to for OTs to take in. One of the things that stood out to me was that intersection of like exercise plus fatigue management, to
Yes.
think of exercise in that way. What stood out to you? I know there was a lot in there.
Yes. So many things. This is where I think it's nice for me to have both the OT brain and the lived experience brain. And MS is one that we all know is really tricky because everybody's a little bit different on how they experience their symptoms based on where their lesions are located. And my first thought was actually because when I made the Team USA, our athletic trainer had asked me to provide, is there any research out there on MS in elite athletes? And there wasn't anything out there really. And so there's certainly a gap in the literature that I think exists for a lot of different conditions. But I think as far as the areas that they hit upon in this systematic review of things that matter, the exercise, obviously a huge one, I think, for a bunch of different disabilities, but for MS in particular, like I took a couple weeks off after Paris, let my body rest and recover. And I actually felt myself towards the end of the like 2-3 weeks of feeling worse by quite a bit, dragging the fatigue, the cognitive fatigue, pain, a bunch of that stuff, even just like my mental status kind of felt like I just felt off. And so like I knew I needed to get back into the gym and exercising and that routine aspect of things. But I think what you said is important of like, there is a threshold there that we have to manage because there's so much about fatigue management and not overdoing it. And so like for me, my lived experience is like a cliff that if I push myself too hard, I fall off the cliff and have a hard time with the fatigue and other related symptoms. So it's like being so mindful of your body. And that's where they talk about like the mindfulness. It's not only the mindfulness of like where I'm at mood wise or present in my body. It's like understanding changes in my body and picking up on those, particularly because as an elite athlete, I was actually in my medical records, it was said submitted for the US OPC, the United States Olympic and Paralympic Committee. It said in my medical records recommending discontinuing training at the elite level because my physicians disagreed with me continuing to train this hard. And they said, because April of last year, I noticed changes in my body. I'm not recovering. Things are getting harder. And it's not going to, usually a little bit of rest and I feel back towards myself, and that wasn't happening. And so I asked for the MRI and like, no, it's just because you're working full time. You're training as an elite athlete. You're putting your body through stressors, which causes the pseudo symptoms connected with MS. And that's what we think is happening. And it ended up actually being a true relapse with new lesions in my brain and spinal cord. And then like you training this hard, you working full time, all these things are too many confounding factors for us to like figure out what is really happening. Is it a pseudo symptom because you're overstressed, or is it a real lesion? Like we need to have a clear diagnosis. But I think me advocating for saying I'm really in tune with my body, I'm really mindful of the changes that are happening and how my body works. Then I have to adjust it. Like after that relapse, everything went haywire and I had to readjust my like baseline level. But I had to learn how to kind of manage my own body and know when to pull back, when to keep pushing. But it is a fine line.
Yes. Yeah. And thinking from an occupational like therapist perspective, when we're working with people that have MS, just like what you said, like you understand your body more than I do as the therapist coming in. And so like teasing out what my role would be that would be most helpful for an MS patient is, I think kind of sets up the line of questions I want to ask you from here and just kind of walk through the OT process with you.
Yeah. I will say the one thing that I thought was unique that you don't often hear about from the results of the study was the participation in work.
Yes.
And I think it's so important. Like it's not even about necessarily the work, the job, or like the financial aspect of it. It's that purpose, that meaning to like get up and go, even when you don't feel like it, even when you don't feel well, someone's relying on you. There's somewhere you need to be. You need to get up and go. Mm-hmm. Has been important for me. I worked full time at St. Louis University as a professor, as I said, and that's been a lot of what keeps like me having to like use my brain and think and get up and get out of the house and be active and be social, and helps even like with the mental well-being of feeling like you're accomplishing something and have purpose. So like we do that as OT. We encourage that as OTs. We should be encouraging that But you have to have meaningful activities that you're engaging in. It's just too easy otherwise to lay around and watch Netflix all day or something.
Yes. Yeah. Yeah. I also, that line in the paper stood out to me so much too, because it makes so much sense as an OT. But I hadn't read that so explicitly. And I definitely hope that's something that people tuck away in their brains and
Exactly.
pull that up and think about that for our clients with MS. Thinking about walking through just like the OT session with this paper in mind, pulling from your experience, I wanted to start just at the top, kind of thinking about goal setting. And we know overall from research that when we're setting goals, ideally they are set by our clients or collaboratively with them. And hopefully these goals are lofty, like that they provide that level of challenge. I'm curious, just from in your life, what you've learned about doing that. I just look at you and I like assume that you are goal setting for yourself.
Yes.
And what advice do you have for us as OTs when we're showing up with MS patients, kind of bearing in mind, like you have so much expertise in your own body. What advice do you have for us for that like collaborative goal setting process?
The number one is that it has to start with being collaborative. As you said, you don't know my body, you don't know and all the experiences are so variable with MS, depending on the symptoms that person manages, how often they have pseudo relapses, all sorts of things. So it's respecting that partnership. It's different than like someone that's in the hospital with a new spinal cord injury that has never experienced this. They don't know their body. They don't know what happens next. A lot of times the people with MS or a bunch of other either congenital or progressive diseases, they've been living with that for a long time. And so they've kind of figured out what works for them, their preferences, they know their body really well. So collaborative goals in that way. And then making sure that we're not limiting anybody. Plenty of times I was told not to train at the elite level or not, like that was going to be too difficult to achieve, but instead saying, all right, let's like, if you really truly feel like it's too lofty, can we just break it down and make it something that's achievable? Because obviously it feels good when you can achieve that goal and then write a new one. A lot of my achieving my goals, most of them came from just wanting to prove other people wrong. And that was one of my big motivators in doing so. So, but when I have people along the way saying that's too lofty or you can't do that, it's just enough to kind of discourage you, particularly as someone with MS who's constantly being put in a bubble and told to like take it easy or maybe too much. It's really easy to start to limit this population. And I think it's one that we need to be giving the message that, no, you can with a bunch of supports potentially. But the goal is to continue to be active and moving and engaged in activities because that's what brings about improvements in health and well-being.
Mm-hmm. Yeah, and I think as healthcare providers, we need to look at ourselves critically and be like in our minds, we're always showing up hoping to empower people, but there are so many stories of when healthcare providers are limiting people. And yeah, to look at ourselves with that critical lens. And like you said, if it feels lofty to be like, can we take it in steps and let's go. Let's go
come
there.
With a huge toolbox. That's what I can tell you. Come with a big toolbox of ideas from adaptive techniques, adaptive equipment, strategies, education, you're going to need your whole toolbox with this population because it's so variable. It's variable person to person. And then even for each person day to day or week to week, variable on what this disease looks like. So for me is very like right now I feel great. Like my body is super cooperative. I have energy. I don't feel like cognitively cloudy. And so like, I'm going to work on some of those loftier goals is a little bit easier. And then understanding there's dips in the progress towards those goals. And when there's dips in the progress in the goals, it's easy to say, I need to downgrade this. We need to discontinue this goal. We need to adjust it instead of saying, no, stay on track. Like small adjustments, but stay on track towards that long-term goal and understanding the body's just fluctuating a little bit. And that's okay. It doesn't mean you're like completely off the rails, off track.
I wasn't expecting to ask you this, but I just have to. I feel like so many times as OTs, we step into this fixing role. Like, I'm going to tell you what to do. And I think partially we do that because we feel like our clients want us to do that. Like they're showing up to us like for a fix. And it almost feels like, I don't want to say, it feels like we're not tricking them, but instead of having a fix, it's like, let's collaboratively set goals and there's trial and error. And we feel like we're subverting their expectation of what therapy should be.
Yeah.
Do you think, is that like a false story we're telling ourselves, that clients are coming to us wanting a fix and they don't want to do this trial and error collaborative goal setting? Or do we need to reframe the conversation there?
Well, I think everybody's a little different. So you have to just kind of pick up the cues for what is that person wanting. Yeah. And where they're at. Are they looking to just problem solve this and get a bunch of different ideas of how can this work? And usually, like I said, they've come in having dealt with changes in their body and they've kind of figured out how they work through that process. Like it's just as important to pick a specific goal as it is to figure out like, what is my process for managing a relapse? What is my process for managing a new goal? And kind of giving them a lot more of the skills that we have as OTs in critically analyzing an activity to be able to kind of OT themselves. Because it's something you deal with that fluctuates too much. My OT is not always over my shoulder telling me what to do or how to manage it. But if we can instill some of those skills within themselves, that's usually pretty helpful.
Yeah.
For anybody.
That's super helpful to hear. I wanted to talk or give a little time just to talk explicitly about exercise as I read this paper and some of the supporting research. It seems like something as OTs we should be keeping it in our mind as just like this huge potential for fatigue management. I think so often when we think about exercise as OTs, though, we think home exercise program and like, let me set these things for you. And hopefully you're doing them for the course of the time that I'm with you. But it seems like what we should be doing is thinking really holistically about how can we work together to make an exercise plan that you can maintain for hopefully years. And that's probably in the community. That's probably with people. It's not a home exercise program. How can we do that as OTs? Like set people up like for something that's actually sustainable, like what you do. That's so different than what we usually do as a home exercise program. What does that look like?
Well, and to be fair, I hate being in the gym. Like it's one of my least favorite things to do is be in a weight room. And the only reason I really use because that is part of my occupation of like being an athlete is that I have to kind of do that. But for those who just like, I know that I need, well, now I'm not, right? I'm in an off period, transition period. So for me, working out, and I forget this, working out can just be for your health, not for training.
Never, yeah.
But that's what I love about adaptive sports and activity. Like it can be physical activity. It doesn't have to be exercise. And I think a lot more people are going to commit to and be involved in physical activity. And that comes with having like a goal and doing it with other people and having a community of people. So it's like I'm going and hang out with my friends while we're doing a group exercise class. I'm hanging out with my friends while we're going on a walk through the park or, things that you've got to find what they actually enjoy doing and try to incorporate physical activity into that task. And you're going to have much better success rate. And as you said, people, they actually a ton of studies out there on how do you get adherence. And this is mostly in the able-bodied literature on how do you get people to adhere to exercise. They've got really clear delineated of like, this is how much exercise you need at this intensity for an able-bodied population. But obviously the biggest factor there was if they had like kind of the accountability or socialization to do it, to go work out with others is what made people continue to do it. And so like, for me, that's why I love promoting adaptive sports is you're doing it with others and you're getting so much more than just the physical activity of it. You're getting the socialization, you're getting the peer support from like-minded people. You're getting, tons of stuff.
Yeah. Oh, I never would show up to exercise if there wasn't someone waiting there for me.
Yeah. I'm not a fan. But some people love just like, and it's fine for people that love just like
other people like it. Yeah.
Tune out and get the workout in. But I'm definitely more, I've always done team sports. I've never done individual sports because that's part of what brings me joy is being around others. And getting encouraged by others and encouraging others. So,
do you think as OTs we can like step into the role of having people find that? I mean, that feels within our scope of practice, but I think lots of times we're just like, here's a home exercise program. Like, That's totally different.
Yeah, the adaptive sport part of it in particular, I don't think it's exposed enough. There's like a small population when you got like a 19-year-old that gets spinal cord injury. People are like, oh yeah, I should definitely introduce adaptive sports. But like whether it's talking to a female or talking to maybe an older adult, my mom's 60 something and playing pickleball. Like there are physical activities that people can enjoy, even if it's something low impact physical activity, swimming, bocce. Like there's so many different ways to get out and just go move your body. That's what I always tell myself. Even when I'm not feeling well, even when I don't want to, when my body's not cooperating, it's going to be a horrible workout session. I know it's like, go move your body because that's what I need to do. And it's like way boils down the goals and the expectation of what that session looks like for me, but it's still the expectation of move your body.
Mm-hmm. I want to ask about the flip side, or I guess the intersecting part of that, which is fatigue management. What have you learned about fatigue management that you would want OTs to know?
I think it's the two parts. One is how to monitor it. And then the other is action steps based on where you're at from monitoring it. So like for me, I'm more, either they use like the battery as an example or your rope or different things. And like for me, it's always been like it's like a laptop. If you're running your laptop on when it's being charged, like you can get your stuff done and keep working hard and keep it a steady pace. But as soon as it's giving you that flashing warning that you need to plug it back in, except my body gives me so many flashing warnings that you need to recharge. If I ignore it, my computer's going to die.
Yeah.
And it's going to take a long time for it to like boot back up. And then of course it's going to go through the, hey, you need to get updates. And then all the 15,000 tabs pull back up and you're trying to figure out where you're at and all this lost time having to reboot the computer that died because you let the battery go. So it's better for me when I start having those warning signs to plug myself back in and recharge. And so I have to be super mindful of when those moments are, but also reframing because I'm active. I have so many obligations and things that I need to do. I think we get that a lot from our patients. They're like, well, I still have to get this done. No matter what I feel like, I still have to take care of the kids. I need to go to work. I need to visit whoever, like go be social, go out to dinners. And I don't want to slow down my life because of this disease, but I know I need to recharge. And so like, it's a good example for me is for my training isn't just physical. It's not just getting in the gym or going for a push. It's also calling a teammate and building that relationship or watching film or focusing on my nutrition or getting a good night's sleep or doing some meditation. Like there's other things that I can do that helps me towards my goal of being a better athlete within my training that doesn't always have to be physical. So it's really trying to open that mind to like, how can I not put anything on hold? I'm not pressing pause. I'm just shifting the gears a little bit when my body's less cooperative. But it starts with being able to identify and understand my body is fighting back. Here's why, which gets frustrating as a person with MS because there's not always a clear precipitating factor. There's not always a clear like, oh, I feel like crap today because yesterday I did this, unfortunately. In fact, I got kind of tired of trying to find those correlations over and over and over, trying to understand, well, what do I need to do differently? It's like, sometimes you just have to stop trying to understand it and just know and trust in your abilities to deal with, all right, today I'm at a 8. I need to make sure I switch and do this, this, and this so I can keep going.
Mm-hmm. Is that like a interoception exercise, like learning what that battery draining looks like for you? Because it would feel different for every person, I assume.
Yeah,
is that the best way to
subjective.
think about it? Like an interoception, like we need to figure out what that low battery feeling is for you.
Yeah, and what you're willing to push through, and what you're willing to push through based on attack. Like I'm willing to push through a lot when I have to go be on the stage for USA. I'm going to push through a lot when I have to teach for my students. I'm not going to push through a lot to just go meet my friends for dinner. So it's being able to understand like where do I need to be to complete this task. But it is certainly being able to like identify where you're at on some type of scale and like so deeply in tune with your body, which is so different for everybody. I used to ask a lot of my clients when we talk like related to pain, they'd say, oh, I'm at a 4. And I, talk to them about that and then say, what's your threshold? Like, are you someone that can handle a lot of pain? What's your number? Like, I have to stop. And really getting that kind of down pat. As I said, the having processes in place for a bunch of different things within it, and not just like a goal towards an activity, but a goal towards being able to identify when your battery is drained, or being able to identify when you need to switch to a different strategy, more of a compensatory versus just a push through strategy. Big toolboxes. I can go back and big
Yes.
toolboxes. But it doesn't do us any good if the client doesn't know when to pull out what tool. That's where I go back to like teaching them how they can identify within themselves. What do they need in this moment? What does their body need to keep on track and not keep draining that battery?
Part of our toolbox, based on what I'm reading here, would also be patient education.
Huge.
I'm going to be honest, though, if you came to see me, I would feel so uncomfortable teaching you anything about MS. Like, how do we work collaboratively on education? Like, how could we reframe what education looks like, I guess?
To be fair, I am not a great case example here because you're working with a knowledgeable OT.
You're not
I think in general, 90+% of what we do as occupational therapists is educating. Whether we're educating a client or a caregiver or a staff member, whatever, it's trying to take what we've learned in our brain about OT and what works, and trying to give that knowledge to somebody else so that they can utilize it. Whether it's an adaptive technique or a piece of equipment or an energy conservation or fall prevention type strategies that they can incorporate in. And so, I mean, you may not be an expert at MS, but you can pretty quickly learn how to educate on fatigue management, energy conservation, mindfulness, a whole bunch of different exercise. I mean, there's tons and tons of resources out there and handouts that, whether from introductory, let's try these strategies and see if these work, to really complex. So just start with the basics. Start with, let me see if we can pick 3 energy conservation strategies from this handout that you feel like you can incorporate into this occupation. And then we'll just go from there. But I usually tell my clients, like, you're probably doing a bunch of these. Even if I can just come up with one more that's different from what you've already been doing, we'll call that a win. Or if together we can come up with one more strategy that helps build your toolbox, that's a win. And then you leave it to the clients. You'll say, yeah, that works into my lifestyle, or that doesn't. Which, being mindful, there's just so much complexity that goes into what works into somebody's lifestyle that's so individual. I've got a pair of forearm crutches in my outdoor closet that I've never used in my life that the PT gave me, and didn't realize like that does not work with my lifestyle at all. It's too slow for me to get around, painful on my arms, that I need to be able to be an athlete. Like, there's just so many reasons that's not a good fit. And if they would have just had a conversation with me, it's like, okay, well, let's try a different tool, wheelchair. Here you go. Like, simple conversations.
Yeah.
And then digging deep into the different aspects of their lives. Cause I use different tools during different things that I need to do throughout my day.
Yeah. Yeah. I love thinking about I guess haven't thought about education as like a collaborative exercise before, but being like, here's an area, as an OT, you're thinking, here's an area I want to explore fatigue management. Let's learn together what that looks like for you.
Yeah. Yep. And see how the strategies apply to their particular set of circumstances. It's kind of that idea of like activity analysis versus occupational analysis. Like, we can generalize what it takes to complete an activity, but when we call it an occupation, we're now incorporating all of the other factors that goes into that person, their routine, their values, their supports, like a whole bunch of other aspects that make it really unique to how they complete that occupation. And we need to do the occupational analysis, not the activity analysis, when we're coming up with our education and treatment interventions and ideas. But the thing I saw a lot with students and new grads, and continue to see as a professor, is feeling like you're not competent to educate a diagnosis. But often you can say, I can be competent in educating on a deficit or a problem area that is common with this diagnosis. And you can just make the small adjustments based on that the diagnosis and the deficits as needed. But for the most part, you know more than you think you know.
Yes, yes.
And we get brainwashed. I was just telling my students that this morning. I'm like, we brainwash you to think like OT, so you think everybody thinks like this. And remember, not everybody thinks like this. You're just constantly surrounded by people who do. It's not always as obvious as what you think it is. So just start educating on the basics and go from there.
So much of the article was about exercise, fatigue management, education, but then there were like 10 other things, mindfulness, nutrition. I was wondering, or were there any other things that stood out to you that have either been helpful or you would be good for like OTs to key in on, from that like mindfulness to nutrition and
Yeah. It almost becomes overwhelming how many things you kind of need to keep track of that can influence my participation in what I want to be able to do. But I think it's important that we as OTs and our clients understand. So it's at least on our radar to be thinking about, okay, I've been feeling really crappy lately. And I've went through it. I'm not overdoing it exercise wise. I'm getting enough sleep. I'm not too stressed. Oh, I'm eating like crap. That's what it is. Pardon my language. But like to be aware that all of these things have an impact, and there's some that have a bigger impact on somebody with MS, or maybe like for me in particular, there's certain things that have a bigger impact on my battery, as if you will. But I need to make sure that's part of the differential diagnosis, essentially, when it's like things aren't going well, my body's fighting me, that I'm considering all of these things that go into feeling well. And we forget about a lot of them. And a lot of them are really powerful. Like the mindfulness part is one I pushed away for a while. And it's actually one, and it's mostly just being like mindful of where my body's at and how it's feeling and where is it fighting me and what areas is it fighting me. But if I can't start there, I can't even identify the problem and we can't really move forward. So you've got to start from a place of them just being thorough understanding of their body and what they're feeling and being able to articulate what they're feeling. Because that's also something that, I can do really well as an OT. I can articulate what's going on. There's a lot of clients, newer clients, aren't even going to be able to articulate. So you got to help give them language that they can play. The same thing we do with pain. And again, with the analogy, but it's like, they say it hurts. You're like, okay, how does it hurt? And they don't know. And see, like, is it sharp? Is it dull? Is it starting to stop? Is it, and just kind of go through.
Yeah. Yeah. And there's so much coming out of the interoception world to help us kind of guide in that process of like, let's get more specific about what that looks like for your body and what language can we give to that, because that's going to be a really helpful tool for you.
Very, very helpful.
There is so much coming out. MS is one of those diagnoses where there's so much research, but there's also so much that we hope will be coming, like you mentioned, like, what does this mean for elite athletes? I just think there's a lot more to come. As an OT profession, how do we need to grow and change to best serve clients with MS in the upcoming years? I just get worried all the time, Sarah, about there's so much information, and like, how do we hold it all and like get it to the clients when they need it? I think there's a lot of technology that's going to come to support us in that, but it's a different way of thinking than like when I started OT. It's like, are you independent? Are you not? Like, okay, if you're independent, you're fine. But we know there's so much more that we could be doing.
Yeah.
Yeah. How do we need to change?
I'm living life at Mod I over here. Like, there's a lot of things I can do independently, but I could do it better. I could do it with less fatigue. I could do it with less pain. I could do it where it's not taking up so much of like cognitive power. So those small changes make a difference. But I think acting as a sounding board for your clients, because there's a ton of information out there, and you better bet they're looking up, everything that they can to learn about their condition, and hearing all these strange diets that they can try and exercise, and then, focus on this, and you should focus on that. Like, so we can help be that person that hears all of it and like puts it together and helps them understand, well, if you do this, it might impact that. Or if you try this, watch for this and see if this helps here, and like help make sense of the information holistically for that client as it pertains to their occupation. Always bringing it back to their ability to complete occupation, obviously. So that's what we do as occupational therapists. But I think applying a lot of what you're reading online to their specific occupations that they want to complete can be really a helpful thing for OTs to do in making sense of it. Is a lot of information out there. And so I hope we, as far as the research progress and the research goes, I hope we don't get complacent. Because there's a lot out there, but I think there's a lot more cutting edge and new. Like, we keep kind of studying what already exists and gathering more information on what we already kind of know about, And because there's so many limitations to those studies. We're just trying to improve that and trying to get stronger evidence, continue like the evidence that backs up and supports what exists. And that's important too. But not letting that limit us from really expanding our view on what different treatment modalities can look like for MS.
Mm-hmm. Yeah, I think even for myself, sometimes I like underestimate the value of being that sounding board where like there is so much information accessible to everyone all the time. So you're like, well, what's the value in showing up to see a person? But the value of that sounding board, I think, is so massive.
Yeah. And to say what makes sense and what doesn't make sense, or what really is grounded in theory and evidence. And don't go like, oh, I'm not advocating go all the way towards like only evidence-based, because there's, especially with this population and a lot of populations, you have to use a mix of the actual evidence and the anecdotal evidence from your client and your own experience. There's so many things that go into a recommendation. And there's things that work that have no business working, and we don't really always know why. But if it works for that client, it works for that client. And you just go, okay, like, great.
Yeah. I have 2 more questions. I'm just curious, like, what you see on the horizon for yourself. And then as you think about this conversation today, like, what stands out as the most important thing you want to leave us with? But yeah, I'm curious what's on the horizon for you. And you've had such an incredible story, and it's been so fun to just watch what you're doing. And
I really enjoyed my time, not only with like seeing the Paralympic movement growing. I mean, Paris was amazing with having the support, sold out arenas, and unprecedented access back home for people to watch the games and support us. And social media, it was exploding. And so we're really excited about the growth of the Paralympics. So being a part of that conversation leading into LA, which is an awesome opportunity for us to have the games at home in 2028. I think particularly for the disability community, because we can use, a lot of people have a connection with sports and they understand sports and they can relate to that. So for those people who have no connection or relation to disability, we can use adaptive sports to bridge that gap and normalize disability and help people feel comfortable and understanding it and highlighting it and including it as in mainstream. And we're already seeing huge progress towards those goals. Plenty more to be made. So I want to certainly be a part of that conversation, as well as I've absolutely enjoyed speaking on and educating on the importance of adaptive sports in exercise for practitioners. Because I've just seen it too many times where a female who would absolutely benefit from participation in adaptive sports wasn't introduced to it. And so I want to make sure that that's on the forefront of a lot of therapists' minds to reconnect people to their athletic identity and understand the pros and cons beyond just the physical health that can come from that participation. So I'm really hoping to use my platform to shout it from the rooftops to make sure it's at the forefront of people's minds, because people know it. I think a lot of people agree it's important, which is not always in the forefront of our mind. And we get in our routines of I do this, this, and this with the client. But be willing to shake up your routine. Be willing to shake up your focus.
Does that look like, I'm picturing 2 levels of that. Like as an OT, I just need to be aware of the adaptive sports options in my area. I suspect there's a lot of people, though, who live in an area where there isn't an option. And then you're like, is that something as an OT I should think about? And what resources would there be for me to bring that to my area?
Absolutely. I think for the people, you kind of feel bad introducing something that's like, oh, but we don't have access to that here in our county. Or it's almost like offering a piece of adaptive equipment that's really, really expensive that we know they can't afford. But I'm always like, I think it's better to introduce it and just say, here's some limitations to you having access to this, but like, let's work together. That's our goal, is to decrease those limitations and those barriers to gain access to these things that we think are really going to benefit you. And I think one of it for me in the policy, like higher level of that is to be advocating to have more adaptive sports and exercise programs. Like we've got an awesome one here in St. Louis with DASA, the Disabled Athlete Sports Association, that has a huge closet full of adaptive exercise equipment and programs that they put on. But that we're lucky in St. Louis, like they don't have those big programs, maybe in a Springfield or somewhere different, somewhere that's a little bit more rural. And so advocating at the policy level, but as a practitioner, I mean, I've known some athletes that like it's that important to them that they've moved to a place where they had better access to adaptive sports in that community. So like, don't limit them If that's something that they're really, really passionate about, they'll find ways with your assistance sometimes to bring down those barriers, or reach out to an adaptive sports program and loan out a piece of equipment. They're like, okay, I'll go drive 4 hours to pick up the bike, and then I have it for the year and I can loan it out. So like, it goes back to that, don't limit people, because in anything that I've decided to do, there's 10 reasons to say no. There's 10 reasons to say, this is too hard. You shouldn't do this. You shouldn't go after that. And every time I was saying, all right, what happens if I don't say no?
Mm-hmm.
And then I just stay on track and keep kind of trugging along. And then the opportunities and access that's provided me in just being able to say, yeah, let's try it, has been phenomenal.
My takeaway from this conversation is that as an OT, wanting to be that person that doesn't limit people, that opens up those possibilities, whether we're working with someone with MS, whoever it is who we are working with. I'm curious, as we're wrapping up our time, what's the main thought that you want to leave us on?
I'd say the main thought, the one that I say over and over and over again, is that kind of just say yes mentality. It is really making sure that you're reflecting on that. There, particularly with this diagnosis, there's a million reasons to say no and to hesitate and to put us into a bubble and be cautious and not want to overdo it. And it's like, go ahead and just push that a little bit, push back on that. And don't be afraid to overexert, and don't be afraid to try something different. Don't be afraid. Honestly, even there's times where it's like the client has some discomfort or ends up falling, or, like, as long as you try to keep it as safe as you possibly can. But sometimes that learning and development and figuring things out happens through failure. And sometimes failure is not pretty. But don't use that as the excuse. Don't let that kind of deter you from pushing those boundaries just a little bit. And you'd be amazed. You just keep pushing kind of where you end up and what you are able to do. Even despite a lot of limitations and a lot of difficulties that I push through.
Well, Sarah, I have just loved getting to hear your story, getting to hear inside, I guess, your mind and your heart, and these coming from that elite athlete, that OT, this lived experience. You weave that all together so beautifully, and I'm just so thankful that you were here to share with us today.
Yeah, thank you. It's a fun conversation. I could nerd out on this stuff all day long.
Yeah, I could go forever. So, well, thank you.
Yeah, thank you so much.
Oh, you all, I am so honored and thankful that Sarah was here with us today and that she was willing to share about her journey and her perspectives on the OT process. There are just honestly multiple parts of this interview that are going to stick with me long term. But one thing that keeps popping into my mind right now is just that importance of widening our OT toolbox, which was highlighted in our research today, but I feel like was really showcased and brought to life by Sarah and her story. As always, I want to hear what your thoughts are. If you are a casual listener, we would love a review from you wherever you are listening to this podcast or on our YouTube channel. But the best place to really discuss the implications of this is in the OT Potential Club, and I will be watching for your comments in our forum. The OT Potential Club is also where you will go to earn a CEU certificate for your time today. What you are going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are in there, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. Okay, I want to thank you so much for joining us. I hope this podcast keeps you informed and inspired as an OT professional. Take care, and we'll talk next time.